you, everyone. So you're probably wondering why a member of Congress from Richmond is here in Tazewell today. But in addition to representing Richmond, my district, Virginia's 4th District, includes from Charles City County down to the North Carolina border. So I have a number of rural localities, and I have one of the 6 Virginia hospitals at risk of closing in my district down in Emporia. But I also sit on the Energy and Commerce Committee in the House, which is the committee that deals with health care, which is the committee that had a 6.5-hour hearing on this bill where I joined my fellow Democrats to fight back against these Medicaid cuts. And I spent almost 18 years in the Virginia legislature, including being in the state Senate when we expanded Medicaid. And we did that on a bipartisan basis. And it was a particular coalition that included Republicans in rural areas who understood the importance of expanding Medicaid to close the gap of who had health insurance. And because when you don't have health insurance, you still get sick. You still go to the doctor, but oftentimes you don't get your primary care. You're showing up in the emergency room when the cost of care is much higher. That care is going to be compensated, and then the rest of us pay for it through either higher health care costs that we pay or higher insurance premiums for those of us who are insured. And so from all of those perspectives, having been a patient, having been a family member of a patient, I understand how critically important our healthcare safety net is. And so in addition to joining Protect Our Care, I have been traveling around, particularly rural areas, to see firsthand the impact that these Medicaid cuts are going to have on our rural communities and sound the alarm. So this morning I was in Abingdon, visiting a dental clinic where over 80% of their patients are on Medicaid. I have in my district a long-term care facility where 90% of their patients are on Medicaid and the other 10% are on Medicare. And I'm here to say, first of all, this big ugly bill that was signed on July 4th is not only the largest cuts to Medicaid in American history, but according to the Congressional Budget Office, is estimated to kick 17 million Americans off their health insurance. And that is through 2 ways. First, the cuts to Medicaid and the changes to Medicaid eligibility that require onerous paperwork for many people to prove they're working. And we've seen in states that have adopted those requirements that even people who were working, who were eligible, or fit one of the exemptions still got kicked off of their health insurance. But the bill, because it adds $4 trillion to the national debt, triggers cuts to Medicare that will cut critically important services to our seniors. And because it does not extend the tax credits for people who buy insurance under the exchanges, that's how they get to that large number. It'll be hundreds of thousands of Virginians. And again, they're still going to get sick. And they're going to show up in our emergency rooms when the cost of their care is much higher. It is going to affect our hospitals. And just to pick up on something Katie said about the provider tax is how states pay their share of Medicaid, because Medicaid is a federal state program. And our providers, they were willing to pay that provider tax. And yet this bill will limit how much of a provider tax states can impose, doesn't tie it to inflation. And as you know, the cost of everything is going up, including their cost to provide care. And yet by handcuffing the state and its ability to pay its share, while then blowing a hole in the state budget through these cuts to Medicaid, through cuts to the SNAP program, by shifting more costs of education and many other issues back to the states, the General Assembly and the next governor are going to have to make some really difficult decisions about whether they raise taxes or what services they're going to cut. Our local governments are going to have to make those really tough decisions too. But more importantly, what I am seeing is whether it's in Waverly or Emporia or Tazewell or Abingdon, places that already were healthcare deserts could lose the only providers that are there, because without Medicaid and the funding they receive, they just can't afford to provide the care. And you would have more insured people who, when they do find care and have to drive even farther to get it, they still won't be able to afford it. So we're sounding the alarm. It is not too late to turn this around. Senator Josh Hawley, a Republican, has filed a bill shortly after he voted for Medicaid cuts. He filed a bill to reverse them. I am co-sponsoring a bill in the House to reverse these Medicaid cuts. And while they don't take effect until January 2027, as I mentioned, the state's going to have to make decisions right now about how to reflect these cuts in their state budget. And we're already seeing providers around the country, including one in Nebraska, that are either closing or about to close their doors, and specifically say it's because of these Medicaid cuts. So I want to thank you for being here. I hope you help spread the word about how we need Congress to act now to extend the tax cuts for people to buy under the exchange, which, if Congress doesn't act, will expire at the end of this year. That we need to make sure that Congress reverses these Medicaid cuts and do what we can to ensure that every Virginian, and I'm doing everything that I can to ensure, not just every Virginian, but every American, regardless of your zip code, regardless of who you voted for, regardless of where you live, that when you need care, that care is there, it's quality care, and it's affordable. So thank you all for coming out today.